Subscribe to Awaaz today. Click on the bell icon for latest national and international buzzing news.
I'm Dr. Darrel DeMello from Mumbai, India, and I'm here to talk about COVID-19. I want to thank Awaaz today for this opportunity to be able to share some insights into COVID-19. I got intrigued with this disease of what we call coronavirus 19 way back in January. Since then, I've done a lot of research on this disease, and I started actually treating patients in the safety and confines of their own home using telemedicine in May. Till date, I've treated approximately 3,000 patients. That includes relatives of the immediate patient. So in total, it's about 3,000 plus patients. Let's talk about what is COVID-19. COVID-19 is a new disease caused by a new virus from the coronavirus family. Not much is really known about this virus or the disease. This disease actually has very dangerous side effects on the lungs, on the heart, on the kidney, on the liver, on the brain, and all your organs. This damage is due to the response that the virus elicits from the body's response system, which ends up in clotting of all these organs. Blood clotting is the major cause of damage to all the organs. So when somebody asks me, why is this disease different, or why is this virus different? It's different. It's not the same virus that you have. This disease is really causing clotting in all the major organs. And the clotting causes damages that it leaves behind. When it leaves these damages behind, as a patient, you may end up with heart failure, lung failure, liver failure, kidney failure, and you may have brain problems, psychiatric problems. So there's a lot of things that can happen to you. These damages can be seen not just days, but weeks and even months later. I still don't know about years because it's only been a few months now that we've known about the disease, but I've seen damages now for weeks and months later that we've started seeing damages. So when I approach this disease, you will ask me a question, how do you treat such a disease? So I have done enough of research on this disease to understand what happens in the disease process. And I've come up with a two-drug regimen, which is the cornerstone of my therapy. Given the fact that we have no cures, no vaccines, no drugs to treat this disease, this situation is pretty dangerous. So having come up with the two drugs, I've used it very effectively in all my patients. The two drugs I use are colchicine and ivermectin. Let me show you the two. This is colchicine. It's a very commonly available drug, approved by the FDA and all regulatory bodies across the world. It's an age-old drug, 1,000 years plus in usage, and it is repurposed for the treatment of COVID. The second drug that I use is a drug called Ivermectin. And Ivermectin, again, I'm going to show you the two things that I have. Ivermectin is a drug that, in medical terms, we talk about reducing the viral load. In layman terms, that means killing the virus. So this drug I use to kill the virus. The other drug I use to reduce the body's response system, which eventually reduces the ability of the body to clot. That clotting is what will not damage your organs, your heart, your lungs, your kidneys, your liver. So those organs won't get damaged with these two drugs. So far, it has worked very well for me in my patients. I have very few admissions and just one death in all the patients I've treated. So effectively, these two drugs are the cornerstone of my therapy. In this section, let us talk about the tests I rely upon and the treatment of what I do. So the tests I rely upon are a thermometer. Basic basic need that everybody needs to have is a thermometer. I need to know what the temperature is at least 3 times a day. Anything with fever is very important for me because that tracking is very important. The second test is a pulse oximeter reading. And the pulse oximeter reading is something like this. So here's the pulse oximeter that I have. I don't have a number already up there, but that's something that I depend upon. And it depends again on when the, so what is the amount that we look at? Above 95 is normal, and below 95, I start getting concerned. And anything below 85, the patient goes to hospital because they will need oxygen. The third one is a chest X-ray. The minute the patient talks to me on the phone, I immediately ask for a chest X-ray, if possible. If a HRCT, a high-resolution CT scan is possible, I ask for that. I mainly depend upon the chest X-ray to understand what's happening in the lung. The CT scan is mostly used for confirmatory of the COVID disease. The next day, I will ask for certain blood tests to evaluate baseline enzyme readings of the heart, the lung, the kidney, the liver, and the muscles to understand what's happening in those areas. So those are some of the tests I depend upon. My treatment then is based on the day of start of symptoms. What is the day of start of symptoms? Day 1 is when fever occurs. Without fever, there's no COVID. बुखार के बिना COVID नहीं होता है. बुखार होना चाहिए COVID के लिए. Some of the other symptoms are loss of taste and smell, sore throat, irritation in the throat, cough, dry cough. It could be a deep guttural cough. And so in some patients, you could even get diarrhea. And diarrhea is usually seen later on in the disease process. But they can come to you with diarrhea. This is in the early phase. This is between day 1 and day 7. When some patient talks to me about breathlessness, inability to breathe, or heaviness in chest, that means they're more in the moderate to severe stage. Because once the clotting in the blood and the lungs occur, the breathlessness will stop. So an ability to breathe becomes very critical, determining your severity of disease. So let's go back to day 1. Day 1 is the day of onset of symptoms. So whether it is fever is the day 1. Day 1 to 4, I treat in a particular way. Day 5 to 7, where they may have loss of taste and smell, they may have dry cough, they may have diarrhea, they may have even slight heaviness in chest. Maybe around day 7, they'll have that. That takes another different way of treatment. And then day 7 to 9, when they actually come to you with the presentation of saying, I can't breathe, I'm feeling very odd, I have heaviness in my chest, I have a cough, I had fever 6-7 days ago. That is again another thing that we have to base our treatment on what they're telling me. And if they come to me after day 9, it's usually straight to hospital, because after day 9, if they have heaviness in chest and breathlessness, I cannot take care of them. Their pulse oximeter reading will probably be less than 85, much less than 85. They will need oxygen. They also need a ventilator, so that's why they go to hospital straight away. Now let's talk about the treatment of such patients. There is really no standard treatment. I personalize every treatment. I individualize it to the person, to his date of onset of symptoms, and to the type of symptoms he comes to me, on what date he comes to me. So this is individualized, it's personalized. I use 2 drugs. The 2-drug regimen I talked about earlier, colchicine, a 1,000-year-old drug. Lots of approvals, lots of regulatory approvals, well-established drug. It's an old drug. It is used for reducing the body's response to the virus. So that's what I use colchicine for, reducing the body's response to the virus. I use a second drug, Ivermectin, in a short course of 2 days. 2-day treatment with Ivermectin. Ivermectin is known to reduce the viral load. So let's talk about the two drugs. Again, colchicine is this drug, and ivermectin is this drug. Okay, so two different drugs, colchicine and ivermectin. Ivermectin is used to reduce the viral load. In other words, for layman terms, to kill the virus. It's a great killer of the virus. So if I can kill the virus earlier, faster, the body's response comes down. So this is how I use the two drugs. At the end, what do I see at the end of treatment? I'm most interested in reversal of symptoms. The day the patient tells me, I don't have fever, bukar nahi hai, I'm back to normal. That's the first day that I'm more relaxed. The second thing is the pulse oximeter reading. If that pulse oximeter reading can go back up to 96, whether it was 87, 89, 90, 91, it doesn't matter to me. Can it go back to 96 or 97? That means a reversal of symptoms. And you can see it here. That reversal of symptoms is very important in the treatment regimen. Timing is critical for this disease. The sooner you can come as a patient to a doctor, it makes treatment much easier. It makes treatment less intensive. The later you come, the more risky it is, not only for the doctor, for you. Okay, you may lose your life. This is a deadly disease. Don't delay. So what's my message? My message to everybody out there is, please come to a doctor. Please come to one of us as soon as you get fever. That's the most ideal situation. If you have fever, if you have cough, if you have irritation in your throat, please come to one of us, because we know what to do. We know what to treat you with. If the earlier you come to us, the better chance you have of getting less organ damage. Less organ damage means less lung damage, less liver damage, less kidney damage, less heart damage. The less chance you have of dying of a heart attack, or having breathlessness, or having to need a ventilator. So please come to the doctor as soon as you get the symptom. Any symptom of fever, cough, dry cough, loss of taste and smell, diarrhea, breathlessness, or heavy chest is very important for your treatment. I hope and pray that you follow what I say. Come to the doctor as soon as you get the symptom.
Subscribe to Awaaz today. Click on the bell icon for latest national and international buzzing news.